Thank you, Larry, and I will not tear up your speech. In fact, I will go forward with that. Let me first express my appreciation once again and somewhat surprised for being invited back here again for the fourth year because, quite frankly, my outlook is not any better than it's been for the last 4 years. And in fact, it may have got even a little bit more depressing based upon what's going on today. But at the outset here, let me just also thank UCI and the Mirage School. I particularly want to give a shout out back there to Margaret Wong and Diane Ford for helping us organize the speakers throughout all this. She's been tremendous. She's been there for 28, 29 years. And by the way, 29 years ago, the debt of this country was $3 trillion and the deficit was less than $300 billion. So we haven't accomplished a great deal. I want to quickly cover with you 4 topics. I want to go over the federal budget, the current outlook. I want to touch upon healthcare funding with a slight divergence to talk a little bit about the distributional impact of these programs and transfer programs. I want to also share with you some results from a poll that we recently conducted on healthcare policy. And with much trepidation, I want to touch upon a brief gambit into the political setting that we're dealing with. Before we turn to the fiscal outlook, let me just point out to you that as Jim has already indicated, for us who still believe that debt and deficits matter, it is somewhat discouraging, but maybe not surprising and unexpected when the President of the United States exclaims, as he did recently, who the hell cares about the budget, that the Economist YouGov survey, recent survey, I follow this, considers the budget deficit to be one of the least important issues that the country is facing today, but of course, healthcare being number one. The satirist Joe Queenan recently penned, and I quote, "The American public clearly suffering from some form of a federal deficit attention deficit just doesn't get terribly riled up by the astonishing facts staring us in the face. One reason," he says, is that $1 trillion is a meaningless number. People would pay a lot more attention if it were, say, $634,678.42. It's a more meaningful number. The public also doesn't care if someone steals $3 billion from Fannie Mae, but they really get upset when they read about a $3,500 Pentagon toilet seat. From my perspective, and watching the campaign this year, some might, very reluctantly and not very often, acknowledge there is an issue, but I think they bow to, some of you might remember St. Augustine's prayer, "Give me chastity and self-restraint, but not yet." Nonetheless, let me turn to the highlights of the current fiscal outlook. The key underlying variable, Jim has already touched upon this a little bit, and that is that I'm comparing the CBO, the blue chip, the administration's last week's projections, and you'll see there for going into 2021, 1.9%, CBO, blue chip about the same. The big variable I'm going to come back to in a few minutes down here is that 10-year T-bill rate. Jim and I talked about it a little bit earlier this morning. This administration's estimates reflect a post-policy economic outcome. In other words, the budget submission last week is accomplished. Not going to happen, guys. That budget, we'll get back to it, but it's not going to happen. What is important about these numbers from just a budgeteer's perspective is that a little bit of a tick here and there can make a tremendous amount of difference in the outlook. The one variable here that has stumped most of us, Jim and I talked about it earlier this morning, and that is this 10-year T-bill rate. If I were to call up my presentation, a little reluctantly to this audience, some of you have been here before, if I was to call it up last year, we were projecting that the average on that 10-year T-bill rate would average 3.4% in the year that just ended, and that for 2020, the year that we're in now, would average 3.6%. This is such a critical variable because, as you'll see here, that T-bill rate has continually gone down. In fact, as I understand that when I submitted this slide to the organization for this presentation, it was averaging about 1.64% Yesterday it closed at about 1.5%. Really an interesting factoid is that 1/10 of a percentage point means $185 billion, and more likely a 1 percentage point difference, almost $1.9 trillion in difference going into the future. So that my presentation last year said we would be at, 3.6%. We're nearly 200 basis points below that. The lowest interest rate today has meant that we have overstated by nearly $1 trillion in interest payments on that huge deficit that we have out there. So I think all of us, all economists, should be very humble about our ability to predict that particular variable, and it's critical going forward. Nonetheless, even with the lowest interest rate, other factors continue to move us in the direction of worsening our economic outlook. And so that outlook then has not changed. In fact, the one thing I can say, I told this audience, I think a year ago, that we'd have $1 trillion deficits this year. We had $1 trillion deficits this year, the one time I've been right in a long time. We are also still on a downward path when we put this big bird on automatic pilot if we change nothing else. Now, the annual deficit is here. You can see it for the year we're moving into, $1 trillion, 4.6% of GDP, growing, continuing to increase, $1 trillion deficits throughout, growing almost to $1.7 trillion by 2030. And the debt of this country, of course, increasing clearly along the lines well above the historical average. Now, you can see there, we look at public debt and debt held by the public. I want to focus primarily on public debt. That's debt held by you and me, and not intergovernmental debt like Social Security debt or Highway Trust Fund debt. It just so happens that we borrowed, not surprisingly, the federal government had to borrow $1.051 trillion to fund its deficit last year. Of that $1 trillion, and this is the globalization that Jim talked about, of that $1 trillion that we had to borrow to fund our government last year, 553 billion of it, or 53% of that funding, came not from us, but from foreign investors, the largest one-year increase in foreign holdings since 2014. I argue not only are we mortgaging our children's future by accumulating this debt, we are also forfeiting our future country's sovereignty. So, where does this all go? We are borrowing this money essentially to pay for consumption, not investment. And that's why healthcare is so much the issue going forward. If we were borrowing for those things that Jim talked about in terms of investment for the future and technology and science, I'd have a different story to tell. But that's not where we're putting our investment. We're putting it in these programs, and that's why budgeteers, absent increasing revenues to reduce the current year deficit, continue to focus on this rate of growth in these particular programs. I'll touch on this very briefly. I just would point out that one of the major programs here is, of course, Social Security. And if you plan to retire early and are under the age of 49 in the audience, then you better get to work, because your deficit, your Social Security benefits you thought you were going to get would be about 20% less. If you're going to full retirement and you're under the age of 54 in the audience today, similarly, you'd see a 20% reduction. I would just point out that the President's budget submitted last week says that we get to balance in the year 2035, the year that the trust fund exhausts. Just a slight diversion here. What would be required then? Okay, Hoagland, so you tell me all this. What's required to stabilize the debt of this country? Little amazing. This is I began my career at CBO, so I'm a little biased towards CBO. If we were just to stabilize the level of debt by the year 2049 at where we are today, 78%, which is where we are, historically it's averaged 42%, we would have to increase revenues 11% annually, along with cutting spending 10% annually, for a total of 21% modification in our spending or taxes. That translates into about $400 billion reduction annually to get just to stabilize our debt, not let it explode further. I'll come back to that 21%, something that was mentioned, which I really think is important as it relates to finding solutions to our expenditure and our deficit path. But given the weight of healthcare, let me just focus now on this issue. As we go forward, we see that Medicare, Medicaid, our health insurance program for children, all that, all our major healthcare programs will continue to grow at about 6.4% annually as nominal terms. That's more than just almost, not quite double the rate of growth in the nominal rate of growth that's being projected for going forth over the next decade. That 6.4%, I would note that the President's budget last week has submitted, reduced these expenditures by the year 2030, or over the 10-year period, by nearly $1.4 trillion. 1.4 trillion in Medicare, Medicaid programs. Even if that were true, then the rate of growth would not be 6.4%, would be more like about 5.4%. Big numbers, small percentages make a big difference going forward. So what's the cumulative as we got to the future, where the pressure is on healthcare programs and not so much Social Security as that stabilizes. But again, that area of the budget, which I think is critical for the future, is the one that is getting squeezed particularly, and that is in the area of non-defense discretionary programs. Slight detour with much trepidation going here. The subject of this presentation was deficits, debt, and distributions. Very briefly on distributions. The growth of income that Jim talked about, the distribution of income inequality, they're ongoing topics, particularly in this campaign year. This could be a whole session in and of itself. But between 1980 and 2015, before taxes and transfers, the highest quintile in this country grew by 99%. While before taxes, before any transfers, the middle three quintiles of this country grew by about 33%. But here's the shocker. Here's the shocker. Look what happens after taxes and after transfers are included. The top quintile grew again by about the same, 101%, but the middle three quarters grew by 47%, but the lowest quintile in this country grew by 85%. And why did the lowest quintile nearly double the rate of the middle income group going forward? Sorry, I went too far. When you include the value of benefits provided by Medicaid and CHIP for that quintile, those benefits grew 46.7% over this period. I am not making any judgments here. I'm simply making the point that when debating income distribution in this country, it is critical to include the impact of taxes and all transfer benefits, including means-tested benefits such as Medicaid. And it would appear, at least to me, from this data compiled by the Congressional Budget Office, that there might be a reason why the middle income quintile feels they have not benefited from the longest economic growth in this country relative to the lowest quintile. Back to health. I do not want to trespass on the next panel, but maybe to help set the stage. This is an update of a slide that I presented a couple years ago. It presents the cumulative change in spending per person since 2013 as estimated by Healthcare Cost Institute's most recent report of de-identified commercial health insurance claims from four major health insurers, Aetna, Humana, Kaiser Permanente, and United Healthcare. Once again, it dramatically shows that over the period from 2013 to 17, it was not utilization that increased spending, but average prices, and particularly prescription drug prices. The next panel will clearly dig deeper into this, but I want to point out that when you break prescription drugs into brand and generics over this same period, it's the brand drugs that have had a per-person spending increase of nearly 38% versus generics of only about 11%. There's a major reason why Wendell Primus and others in the next panel will continue to focus on prescription drugs and will continue to be on the legislative agenda for this remaining session of this Congress, if not clearly into the next Congress and going forward. So quickly, I want to talk about some slides here that we recently did a survey in January with Morning Consult. Like the Economist YouGov survey that I presented at the beginning, healthcare ranks as one of the most important issues going into this election year. Republicans admittedly view the economy and immigration slightly higher, but on average, healthcare continues to remain number one, and you'll not find any place on that list the budget deficit, by the way. Digging deeper into what is it that concerns us, it is out-of-pocket costs and prescription drug cost again. Those two areas are the areas where most of the focus is. And what would you do to improve this situation? Well, it would appear to be, and I'm not taking political sides at all, I'm bipartisan, if you can believe it. It says, no, don't repeal and replace, and maybe not transform Medicare for all into a single payer, but build and improve upon the existing system. That would seem to be the majority of where the American public is today. And then for a budgeteer, the hard one. So how would you do that? And what was the public see as the main thing to build upon the current system? Probably not what many of you in this audience want to hear, but the overwhelming response, look up there, number one, increase federal taxes on the wealthy segment of society. And for those of us who have spent our years laboring in the vineyards of budget deficits and focusing on such things as maybe delaying the Medicare eligibility requirement from age 65 to 67, or increasing Medicare premiums, or reducing Medicare benefits, not exactly popular politically, so you end up with what? Increasing taxes. Which leads me to a thought that was touched upon earlier, and that is that maybe as budgeteers are been off completely. Maybe we need to build upon the work of Helen McAfee here with the Memorial Care Health System and the Institute of Healthcare Improvement, along with the work of this wonderful school. And that is also JAMA had an important article a couple of weeks ago by Dr. Shank at Humana, that the healthcare system, we need to focus on those issues that estimate, and I hate this word as a budgeteer, but it's called waste, inefficiency in the system. That maybe we should focus on, number one, failure of care delivery mechanisms, failure of care coordination, overstatement of low-value care, overtreatment, of low-value care, pricing failure, and yes, even outright fraud and abuse. I know it sounds a lot easier, that's why I'm an economist, and you are all the people to solve those issues. Let me close out here with a little bit about the political setting. There's a bunch of known knowns, and there's some unknown knowns. Some of the survey work I've reviewed finds that one of the known knowns, and that's everybody in this room will probably agree, is that we're very divided politically. Republicans, 82% of Republicans say Democratic Party has been taken over by socialists. And Democrats say the Republican Party has been taken over by racists. That's pretty divisive going forward. I will just simply say the national scourge of political contempt, unfortunately, is utterly bipartisan. But then the unknown. Here is a mind bender. And maybe they just use this for entertainment purposes or cocktail parties or something, but it's interesting to me. But given how divided the country is, one big unknown going into this fall is what if there is a tied election? Probably not going to happen, but let's play it out for a minute. It is possible, ladies and gentlemen, I know this is really out there, it is possible that we could actually have a tie on the Electoral College. What happens then? That throws it over to the Senate. And you say, wait a minute, the Vice President of the United States, who at that time would still be Vice President Pence, because the Electoral College meets on January the 6th and the inauguration is until the 20th of January. But it is possible, hard as it is to believe, with all the very challenging Senate seats up this year, that you could actually, he wouldn't be breaking a tie. He couldn't break a tie. In which case, ladies and gentlemen, Speaker Pelosi becomes President of the United States. I didn't put that. So I think it's unlikely, but there are long-term economic costs of a polarized and dysfunctional government. I think even my friend Jim Glassman would agree. If in history there are few, if any, examples of a country with a healthy, thriving economy and a broken political system. So finally, let me just say, back to where I began. I have a brother who lives in Northern California who's a birder. I'm not a birder, but he lives up in Sacramento area. And he tells me there's a hawk. It's called the Swanson hawk. This is an endangered and disappearing species out here in California. I only conclude that, Mr. Swanson, you join our fellow deficit hawks in Washington who have all but disappeared in our nation's capital and are not to be found anywhere on the campaign trail this year. Thank you.